In the article, titled Strength Training as Superior, Dose-Dependent and Safe Prevention of Acute and Overuse Sports Injuries, Jeppe Lauersen and colleagues conducted a systematic review and meta-analysis to find out if strength training can protect athletes from both acute injuries, such as sudden traumas like sprains or muscle tears, and overuse injuries, which develop gradually, such as knee pain from repetitive stress. This is Talking Sports Science with a short summary of their research. First of all, regarding the study characteristics, the review included 6 high-quality randomized controlled trials. Here's an overview of the 6 studies. Altogether, 7,738 participants aged 12 to 40 were included in the studies, and across them, 177 acute or overuse injuries were recorded. Regarding the key findings, the analysis revealed that strength training reduced the overall risk of sports injuries by an average of 66%. When the researchers analysed multiple training variables, duration, volume and intensity, they found that a 10% increase in training volume, repetitions completed, led to about a 13% relative reduction in injury risk, assuming intensity, i.e. weight lifted, and duration, the length of the program, were constant. And importantly, the programs were safe. Almost 4,000 athletes completed months of strength training without a single adverse event linked to the training itself. So how does strength training actually prevent injuries? The researchers found that it works through different pathways for acute and overuse injuries. For acute injuries like hamstring strains or ACL tears, some programs had a direct effect, strengthening vulnerable muscles so they can handle higher loads and sudden stresses. Others had an indirect effect, improving core stability, pelvic control and coordination, as well as better awareness of high-risk situations, which helps athletes move more safely and efficiently, reducing dangerous joint loads and awkward positions that may lead to injury. For overuse injuries, which develop gradually from repeated stress, progressive overload is key. Gradually increasing training loads allows tissues to adapt and strengthen over time. This process conditions the body to become more robust and tolerate repetitive stress, lowering the likelihood of overuse injuries. In short, strength training prevents injuries in multiple ways, by making muscles stronger, movements more efficient, and tissues more robust over time. And lastly, regarding recommendations, based on the evidence, the researchers recommend starting with a technique and familiarization phase to ensure safe movement patterns. Gradually increase volume and intensity, as higher loads bring greater protection. Use periodization and variation to avoid monotony and overuse. And where possible, programs should be supervised by a qualified professional, especially for young athletes. So whether you're an elite athlete or just enjoying staying active, strength training isn't just about performance. It's one of the most effective evidence-backed ways to stay injury-free. And that concludes this summary. As always, I recommend you go and check out the full article. The link is in the description. Thanks for watching, folks. See you next time.